Hello, I'm Howard Heller.
Hello.
Hi. So I'm here with the top 10 health tips, which I'll try to do in 10 minutes. Top 10 list. The single most important thing I can tell you today, if you don't already know, is international SOS.
Thank you.
How many people here have it on their phones? Download the app right now or before I leave the room. International SOS is an emergency assistance company. They're not an insurance company, but they provide assistance for any emergencies, whether it's losing your passport, whether it's getting assaulted, whether there's an earthquake and you need to be evacuated. But they do an incredible job with health-related stuff. They have doctors and nurses available 24/7. They have contacts all over the world. They know which hospitals, which doctors, and anybody who they would refer you to has been vetted by them. They'll speak English. They'll have a reasonable level of quality. If you call them, just say whatever it is, whether it's that you forgot your asthma inhaler at home, or that you're in a car accident and your femur is sticking out of your leg, or you're just diagnosed with leukemia, whatever it is, they will help you. They'll meet you at the hospital if necessary. They'll accompany you to whatever hospital you need to go to. They will come with you back to the United States on the plane if you need care that can't be delivered wherever you are. They are an awesome, awesome company. Get the message? You're downloading it. Okay, everybody download it. Tip number 2, CDC Travel Health. All the information about immunizations, malaria, altitude sickness, all this stuff is readily available on the CDC website. If you're going to a country, especially one you're not familiar with, just check to see if they have malaria there, typhoid, things that you might need immunizations for. They get updated on a regular basis. They get their information from the World Health Organization. So everything on this site is up to date, accurate. You click on the country and it just tells you everything that you need to know. And even for seasoned travelers, I recommend if you're going either back to the same country or certainly to a new country, just check to see if there's something new since the last time you visited there. 3, the MIT Medical Travel Clinic. There are a lot of travel clinics here in Boston. Mount Auburn has one, BI has one, Logan Airport has one, MGH. But we also can provide the same service right here at MIT Medical. A dedicated telephone line, dedicated nurse for travel. You can find the information on our website. So if you need any immunizations, if you need malaria medications or anything else, you can get all that care right here at MIT Medical if you get your medical care at MIT Medical. If you're an employee but you get your medical care somewhere else, then you should go wherever your PCP recommends that you go. But if you get your primary care here, you can get all this care right here at MIT Medical. For seasoned travelers, if you go to India every year and you're going back and you don't need the spiel again about travelers' diarrhea and food precautions and stuff, and all you really need is a new prescription for your malaria medicines or to find out if you need an update for your typhoid vaccine, just contact the travel clinic number or your primary care provider. They can check your record. If we see that you're up to date with your immunizations, but you just need malaria medicines, we send the order right down to the pharmacy and we can bypass a visit. You can bypass that $10 copayment, but more importantly, save yourself some time. So that's really only for seasoned travelers. If you've never been to us for a travel visit, we will want you to come in. Immunizations in general, it's good to keep your immunization records conveniently located in one place so that if you do need to go to a travel clinic, you know which immunizations you've had, so we don't end up needing to give you booster doses of things that you might not need. Malaria, all the mosquito-borne diseases, we'll talk about it and counsel you when you come in for the visit. Again, you can get the information on the CDC website. For most of the mosquito-transmitted infections, we don't have vaccines. All we can do is counsel about mosquito repellents and stuff like that. Check the country that you're going to. The ones that we get most concerned about nowadays, yellow fever, we have vaccines for. But in Singapore, where so many of our people are traveling, they've had a lot of problems with dengue fever over the last few years. Dengue is endemic all through the Caribbean, Central America, Africa. And one of the tricky things about dengue is that it's an urban disease. A lot of people think that, oh, I'm not going out to the rural areas. I'm not going to be in a malaria area. But if you're in the city, you're actually where most of the dengue is going to be. Chikungunya fever is a really nasty viral infection that you get from mosquitoes. It had been in Africa and Asia, then it spread to Italy several years ago, and about a year ago it showed up in the Caribbean. and now all the Caribbean islands. It's spread to Central America. It's down in Brazil and parts of South America, showing up in Florida. And this is a really severe disease. So take the insect and mosquito precautions seriously. Number 6, traveler's diarrhea. A lot of people get diarrhea when you're traveling, and it's not necessarily from infection. It could just be from the changes in the food, the changes in the mineral content of the water. It could be from the different spices. So if you get diarrhea, if it's not a severe diarrhea with fever or blood in the stool, stuff like that, try to avoid taking antibiotics. And that's why I put it on my top 10 list. Too many people rush to take antibiotics when they get diarrhea. And nowadays, we see way more people who end up with complications from the antibiotics than they would have had if they had just let the diarrhea run its course and keep yourself hydrated. So antibiotics should really only be used for severe traveler's diarrhea with blood in the stool, stuff like that. And when you come in for your travel visit, we will give you a prescription for an antibiotic to take along with you just in case, because if you do get severe diarrhea, you don't want to have to rush out to the pharmacy or find a doctor somewhere. So we do give you antibiotics, and the antibiotic that we choose varies depending upon which part of the world you're going to. So for example, in Asia, most of the Salmonella, most of the Campylobacter is resistant to Cipro, so we don't use Cipro there, we use azithromycin. Whereas if you go to Africa, you're more likely to have an infection with something that's susceptible to Cipro, so we'll use that. So just discuss it with whoever you see at your travel visit. Blue Card worldwide. For those of you who have Blue Cross insurance, and pretty much anybody who gets their insurance through MIT, you've got the Blue Cross insurance. So there's something called Blue Card worldwide. Blue Cross has contracts with hospitals and doctors all across the globe. If you get hospitalized at a Blue Cross worldwide hospital, they can bill Blue Cross directly, so you don't have to shell out and then get reimbursed. That's for inpatient stays. For outpatient care, you always will have to pay and then get reimbursed from Blue Cross. But for inpatient stays, and those are the expensive ones, if you break your leg, if you get leukemia, and you need to get admitted to an ICU, Blue Cross will pay the hospital directly. If you're going to be spending a long period of time in any particular part of the world, and especially if you have an underlying medical condition, if you have heart disease and you're going to be spending 3 months in Singapore, or a year in Singapore, I think it's a good idea to familiarize yourself with which hospitals or doctors you might want to go to if something bad happens, just so you don't have to scurry around. If you don't know, then what do? Who do you call? International SOS. They may not send you to Blue Cross Hospital, but they'll send you someplace where you can get good care. The magic $10,000. If you show up nearly any hospital in the world, even if you have Blue Cross insurance, if you have an expensive condition like a broken leg or a leukemia, they're going to make you pony up $10,000 before they will admit you and treat you. In the United States, if you're in a major car accident, by law, they are required to treat you. The rest of the world, they're not required to. You could be sitting in an emergency room with your femur sticking out of your leg, and if you don't have that $10,000, they'll tell you to buy some acetaminophen perhaps, but they're not going to admit you, they're not going to treat you if you can't pony up the money. For most of us who have credit cards with a $10,000 or more limit, that's fine. But if you are responsible for students who do not have $10,000 limit credit cards, or anybody who's not going to be able to readily put up the credit, have a backup plan for who do they call, what do they do in case of emergency, and if they need to be able to put up $10,000 quickly. This is probably one of the biggest problems we run into.
So you call ISOS, because they have access to the insurance carrier we have that provides our business travel accident insurance, can front the $10,000 if you can't do it or they don't accept the Blue Cross card. So calling ISOS starts that process and will help hook that up.
And the same thing happens to international people who come here to Cambridge. If they get sick and they go to Mass General Hospital, they don't get admitted, they will get admitted, but if they need something that's not critical, emergent, they don't get treated unless they have the money up front, except here it's usually $100,000. Another thing is Blue Cross has tightened their guidelines for the reimbursement. They now want you to submit for reimbursement within 30 days. So if you do end up needing medical care, whether it's a sore throat or a broken leg or whatever, and if you're paying out of pocket get the receipts, you can scan it, you can submit all this stuff online, but do it within 30 days, and then Blue Cross will reimburse you, usually pretty promptly. The people who get into trouble are the ones who wait beyond the 30 days. Blue Cross will automatically deny it, and then you have to appeal it, and it becomes a much bigger hassle. So do it all online, do it within 30 days. And lastly, just to let you know that a couple years ago we put together a needs assessment form. It's basically just a long list of all the questions that have come up over the years and things that we think are important for anybody who's running any international program. It's just a checklist of, did I think of that? Did I think of that? Do I have this covered? A lot of this information or questions are found on the ICC website or the travel website, but this was one that we put together at Medical, specifically focused on the health-related questions that you should be asking yourself if you're in charge of any international program.